All right, so sometimes patients die. It happens. You don't want a patient to die. I don't want my patients to die. I want everybody to live. I want everybody to have proper med pass. I want everything to go great. I don't want anybody to be hurt. I want it to be a great day. Sometimes patients die. It happens. I had a nurse tell me one time. She'd been a nurse for a long, long time. She said, "If it's their time to go, there ain't nothing you can do to save them. If it ain't their time to go, there ain't nothing you can do to kill them." That's kind of a way to look at it. But every nurse deals with the death of a patient a little different. My very, very first death of a patient that I experienced, I kind of didn't really feel like I belonged for the rest of the day. I just kind of went through the rest of the day kind of a shell of myself, like, this is weird. What do I do? I'm gonna have to talk to people. I'm gonna have to do post-mortem care. I'm gonna have to, I'm gonna have to still perform my duties on all these other people that are still alive, and this person's now dead. Oh no, what do I do now? And my first time was hard on me. I've seen nurses just break down and start crying right there. I've seen them get sick. I've seen them go in the bathroom and cry for an hour. I've seen people leave, just be done with it. Their first death, they just say, "That's it. I'm done. I'm not coming back." They finished their shift or whatever, but that was it. They said, I'll never do this again. They were done. Maybe they went to a doctor's office. I really don't know, to be honest with you. Everybody handles it a little bit different. That first one was the hardest. It was very hard on me. I'm not going to, but I can tell you the name and the birthday of that person, the room they were in. I can tell you, just about the whole night from that first one. The second one was still hard. It got easier. It was still hard. I remember the second one a lot better than most, but not as good as the first one. It's hard. I would kind of try to finish my day. Maybe not really show any emotion, but you got to talk to it. And I would talk to my colleagues about it. My peers, the other nurses that work with me. I would talk about it. I lost a patient. Whatever this and that. It never gets easier. I'll say it never gets easy. It gets, I don't really want to say easier, but some's going to hit you more or less than others. You may know a patient for 10 minutes. You may know a patient, if you're in long-term care, for 10 years. And then when that patient dies, it's going to get you. I had a charge nurse one time. She told me that she had left the hospital. We were in home health together, and she had told me that she had to leave the hospital because she was having just terrible dreams, terrible nightmares of her experiences from losing patients at the hospital. I could see where she's coming from with that. I could understand. I could relate to that. I don't have terrible dreams from losing patients, but I could understand how the PTSD from that, could make you do that. I've been told, I've never worked hospice per se. I've had hospice patients before, but I've heard that hospice nurses have like an anonymous meeting where they meet together. Maybe once a week, maybe once every 2 weeks, maybe once a month. I'm not sure, but the hospice nurses will actually meet together and discuss, I guess life or death or both. I don't really know. But if you've never experienced the loss of a patient, you're not going to know how it's going to hit you until you do. It's hard to explain how it hits you until you actually do it. And that's something that you have to learn on your own. There's nothing that can be read. or said or written about for you to understand how you are going to react. You are going to take this however you take this. I may take it one way, you may take it another. It's something that you, if you become a nurse, will experience, and then you are going to have to figure out how you deal with it. That's all there is to it. There's no way to give you a right or wrong answer. There just isn't. Just do the best you can. Always do your 3 med pass checks. And, just know in the back of your mind, one of these days it's going to happen. So, kind of a downer moment today, but I didn't lose a patient today. I will say that. I did not lose a patient today. So, it's not about today. Alright, anyways, I hope it helps. Thank you much.